First of all, I would like to request all the participants to mute your mic. Today's topics is a very hot topic, and that is a very much pertinent. That is the COVID vaccination. Now, as because there is a lot of myths, lot of confusion, which is prevailing in our mind, in the minds of the common people, and even in the minds of the medical fraternity also, what to do, what not to do. The topics is very much interesting, and we are lucky enough that we got Dr. Pratyush Kumar, who will be giving us a brief regarding the COVID vaccination. On behalf of Alembic, I welcome Dr. Pratyush Kumar and our eminent speaker, and I also welcome all the participants who will take part in this discussion. Sir, I would like to request to mute your mic, Dr. Pathak. Sir, please mute your mic. Now, with this, I would like to hand over the session to Dr. Pratyush Kumar, who will be taking the entire discussion regarding the COVID vaccinations. And I have a request to all the participants, the questions or the queries that you have, you may ask in the chat box, or you can take part the discussion just after the completion of the deliberation. So that now it's your turn. You can start now.
So hello everyone, I am Dr. Pratyush Kumar, and this is a very important topic for everyone, for healthcare providers and all those public, because there are some questions which everyone is asked for, and because of recent developments which are going on, there are some very valid confusions which is there in the minds of even common people or the healthcare providers. So in this whole webinar, we are going to discuss what are all the current vaccines which are available, what all are its side effects, who all can take it, and in brief, we'll discuss what are all the myths which is floating around, or the misinformation which is floating around, and how we can transmit the correct information, and how we can inform our public to take vaccination, which will be very much needed to prevent further spread of corona in the coming days. So here we go, and this is the basic thing which everyone needs to understand, that in corona we are focused on the viruses and the particles which are there, the target areas. The target areas could be either it could be whole viruses which could be inactivated, or it could be the spike glycoprotein, or the nucleocapsid protein, membrane glycoprotein, the small envelope proteins, ORFs, or the RNA materials. So based on the viruses, there is a natural tendency of viruses to mutate. It's very common with viruses that over the time, as we grow older, viruses will also grow older. As we'll get new therapies, viruses will also learn to survive with the new generation of medicines available. We will bring new medicines to kill those viruses, and viruses will also learn how to evade from those medicines. And that's the basic trend. That's why viruses mutate to survive in the living environment. That's why we say that we should not misuse the medicines, like misuse remdesivir, misuse plasma therapy, because these may in turn lead to various mutations, which are known as variants of concern or variants of interest. So currently the WHO has given names to the different variants which are available. The problem was that we were knowing the viruses, the variants by the name of the origin of the country, like the UK variant, Indian variant, Brazil variant, or South African variant. And that was not very ethical for the public or for the world. So they have named it. Now they have named it alpha, beta, gamma, and delta. Delta is the one which was circulating in this wave of COVID-19. And this is B1.6617.2. This was circulating because it has got more transmission potential. It was spreading very faster, and it was very much infectious, and severity was also more with the Delta variant. Initially, during the first phase, the Delta variant was not there. That's why we had little spread and we had little severity. But this time we had more severity. And for the third wave, these viruses can very well mutate. The transmission and severity may vary from this. If either it could be more or it could be less. But if we act wisely, if we use our medicines very judiciously, then we can prevent ourselves and our community from the third wave of COVID-19. So now there is a different Delta Plus, which is in the news recently. I just want to highlight this also, because that's the stepwise evolution of coronavirus variants are there. There is a constant rate of acquiring genetic variants, and this new Delta Plus is has got potential of more transmission and immune escape. And this newer generation, newer variants have also led to new symptoms, because this new strain has led to the development of new symptoms. In the previous strain, we didn't have lots of diarrhea, which is there in this strain of COVID-19, plus rashes, headache, conjunctivitis, and even the loss of smell and taste, which is much more evident in these strains which are available. Fever, cough, loss of smell and taste is definitely there in all the strains. But what's most important to understand with these newer strain is that fever may not be present in all the cases. Similarly, cough or smell, loss of smell or taste may not be present in all the cases. Patients may have only one symptoms or a couple of symptoms, or a group of symptoms could be there. So even if a single symptom is present or two of these symptoms are present, we should definitely suspect COVID-19. Because in the recent past few weeks, we have diagnosed lots of cases who didn't have fever, didn't have cough, but only had joint pains, rashes, and body ache. Just with body ache, COVID can present itself. So we need to be careful while seeing the patients and evaluating on the symptoms. Next thing is the repurposed drugs, the antibodies cocktail, which is recently come into the market, and the vaccines. They were in the phase of manufacturing from the March last year itself, and now we are in the phase 2 and 3 of the vaccines. Antibodies cocktail have also come into the market. So coming to the recent vaccines which are available, or which has got the emergency use authorization, like Sputnik has come to India. It was there in the Chennai last month. Now it has come to Bihar also. We also have Covaxin and Covishield. Covaxin has not yet got the emergency use authorization because it has not yet published its phase 3 trial reports. And hopefully we can expect by this month end or next month, the third phase results should be out, published in any literature. Phase 3 reports of Pfizer vaccine, Moderna, AstraZeneca, the Sinovac, which is the Chinese vaccine, Gamaleya, which is a Russian vaccine, that's the Sputnik, has already been there, and they have received the emergency use authorization. So what all are the types of vaccine and what all could be the vaccine source? One is the attenuated vaccines. Attenuated vaccines means that the virus itself has been weakened through neutralization techniques or various techniques, and when they are introduced into the body checks it as a foreign particle coming inside our body and gives an immune response, and that forms the antibody. So this antibody helps us to fight against the coronavirus, which may affect us or infect us in the coming days. Polio vaccine is made on this principle. Next one is the genetic vaccines or nucleic acid vaccines. Nucleic acid vaccines are the genetic materials of the SARS-CoV-2, which we extracted. It could be DNA or it could be the RNA. But currently what the vaccines uses is the RNA particles, like the Pfizer or the Moderna. Moderna, the name also is like modified RNA. That's the Moderna. Their principle is modified RNA technique. So they extract the RNA, and then when it's introduced into the body, it triggers an immune response, and then the antibodies are formed, which helps us to protect us in the long run. Pfizer and the Moderna are the one which is using this technique. Then one is the inactivated vaccine. Inactivated is the killed vaccine. Killed vaccines, what we use is the common influenza vaccine is the killed vaccine. And when killed vaccines are introduced into a body, it also forms antibody. What's different with different types of vaccine is the antibody response or its side effect could be different. And the protein vaccines, the hepatitis vaccine which we use currently is the protein vaccine. The common example of protein vaccine, we take out the protein either from the membrane or the cell or the inside the materials, and it's introduced through a vector inside the body. Body detects those proteins, creates an immune response that forms the antibody, and it helps us to fight against COVID-19. Sanofi vaccine is based on the protein vaccine. Then there are viral vector vaccines. Viral vector vaccines, what they do, that there is a harmless viruses like adenovirus is taken. These are the harmless viruses. It acts as a medium to go inside the body. It infects, and then it induces an immune response from the body against the SARS-CoV-2, and that helps us to get the antibody response against the SARS-CoV-2. The common used vaccine was the Ebola vaccine. Even the AstraZeneca, the vaccine which we are using in India is also based on the same principle. That is the Covishield. So these are the basic chart of that. The Pfizer vaccine is the RNA. Pfizer and the Moderna is the RNA vaccine. Oxford, the AstraZeneca, the Covishield, what we are using in India, it uses the viral vector. The Sputnik, which has recently come to India, also uses the viral vector. This is genetically modified viruses, and these viruses are harmless. That's why you use it as vectors. And most of these vaccines have got more than 90% effectiveness. Problem is there only with the storage. Like the Pfizer vaccines needs around minus 70 degrees Celsius of storage, whereas the Moderna requires minus 20 degrees Celsius. But the Covishield, which we are using it in India, or the Sputnik, can be stored in the normal fridge temperature. What's most important is to note is that most of these vaccines, Moderna, Pfizer, AstraZeneca, Johnson & Johnson, Novavax, Sputnik, all prevents around, they have got 100% protection from death or hospitalization. But yes, while even after getting the vaccine, we may get COVID-19, but the chances are that it will be much more milder than if we would not have taken. It could have been a much more moderate to severe COVID, but after taking the vaccines, we are reducing its severity to the mild vaccine. It could just be a mild, or we could be even asymptomatic. But definitely you are protected from getting hospitalized or from a death. So why we have got multiple vaccines? But it depends, because there are multiple principles on which the vaccine is developed. So there are different companies, different thoughts, And they are all trying to make vaccines based on different principles, and they are in different phases of their completion of studies. Once we get, but they get approval from the recognized bodies like WHO, other state health societies. If they get approval from the country or state, then they are marketed. So at present, there are 48 vaccines in the clinical trial, and initially there were 164 candidate vaccine preclinical evaluations. So why do we give 2 doses of vaccines? We give 2 doses because of to get more amount of a secondary immune response, because the immune memory is stored in the B cells and T cells. Sometimes people ask that I have got 2 doses of COVID vaccine, but despite receiving both doses of COVID vaccines, my antibody response is not yet achieved. My antibody levels are still not yet built. So the common problem with that is that the antibody which we are measuring is only the particular segment we measure in the antibody. But if we take vaccines, the immune memories are also stored in the memory B cells and T cells. And that can also protect you from future COVID infections. But we are not measuring memory B and T cells in the common COVID-19 IgG levels. So these go unchecked. That's why sometimes the common tests which we do, like COVID-19 antibody, may not detect the memory B cell and T cells. That's why we may not develop antibody in the test, but in the body, there will be enough memory B cells and T cells to cover you, to prevent you, to help you fight against future COVID infections. So these are some latest data from which is available from our government websites. And so in India, with the 90% of the vaccines which we are giving is Covishield, which is the AstraZeneca one, and 10% being Covaxin. So many people do ask us that which one to take, either Covishield or Covaxin. So here is a brief comparison of Covishield and Covaxin. I'm presenting it to you. Covishield, as I told you, it uses the viral vector, which is the chimpanzee cold virus. It is a non-replicating strain. It means that the viruses which we are using as a vector is a harmless one. Whereas the Covaxin is the inactivated SARS-CoV-2, which is disabled for replication. It means that whenever the Covaxin is being given, it uses the same viruses, but that virus does not have the capability or capacity to infect you or cause the coronavirus disease. And the doses regimen has been changed when it was started from 4 to 6 weeks to 12 to 16 weeks. It is based on the recent data regarding the antibody patterns that led for the NTAGI community, which is the head body for vaccines in India. They have recommended a gap of 12 to 16 weeks for the Covishield, but the Covaxin still needs to be taken between 4 to 6 weeks apart. Covishield has an average efficacy of 62% when 2 doses are given 4 weeks apart. But if you take after 12 weeks, then the efficacy is around 90%. The third phase of Covaxin interim result, the final result is yet to be published, has given efficacy of around 81%. And this is the government notification which came on 13th May, when they asked us to give the second dose of Covishield after 12 to 16 weeks from the first dose. Regarding the safety of vaccines, vaccines have a high level of efficacy across all population. And overall, it's very much safe and effective. Even there are lots of questions that people with hypertension, blood pressure, like diabetes, poorly controlled diabetes, asthma, those with chest issues like any kind of COPD, asthma, liver or kidney diseases, or any chronic diseases like malignancy, or if they are suffering from any kind of allergy, whether they can take vaccine or not. Answer is yes. All these comorbidities, they can take the vaccine. Only thing they have to keep in mind, that they should not be acutely ill or they should not require hospitalization. Those who are in hospitals, those who are hospitalized, or those who are acutely ill, like they have fever, cough, cold, they should wait for at least 2 weeks to take the vaccines. So this is one from UNICEF, the safety of COVID-19 vaccines for children. We are all very much concerned regarding the third phase, and there were reports that third phase will affect children more, but there are enough data to tell that it's not going to be affecting children more than the adults. The reason behind that is that in children, the immune levels, like immunity is not well developed, and from the data which is available from current wave also shows the children are not very well, they don't develop the severe response from COVID-19. So what we expect that in future COVID waves also, children won't be affected that much as is coming in the news. And next is how to best protect yourself from the new coronavirus infection. So to protect yourself from the coronavirus infections, we need to follow the same rule. Like we need to wash our hands very frequently. We don't need to touch our face. We need to maintain a distance. We need to mask up well. Now there's also evidence that we should use double mask because that will help us to prevent from COVID-19, because there have been reports of its airborne transmission. Earlier, we thought that it's transmitting by droplet ways, but now there's enough evidence to show that it can also be transmitted through airways. It means that the COVID-19 virus can spread much more faster and much more longer than what we used to think initially. Now, talking about the side effects of Covishield or Covaxin. The common side effects for Covishield or Covaxin are like anaphylaxis, because it does contain its own protein materials. There is a vectors involved. So anaphylaxis is very common with anything you inject. There is something foreign in that, and that can induce an anaphylactic response. Okay. Even with antibiotics, we have seen anaphylactic response. Even with injections, we have seen anaphylactic response. So anaphylaxis is very common in injection, but yes, we need to be careful. And that's why after taking vaccination, we have asked everyone to stay there at the vaccination center for at least 30 minutes so that we can see if there is any allergic response to the vaccine or not, if there is any kind of tachycardia or breathlessness, if there is any kind of anaphylaxis, we can manage it there and there itself. There could be tenderness, pain, and warmth at the site of injection, which is very much common with injections. There could be stiffness, there could be fever. Yes. In the second phase, after taking vaccine, lots of patients came to us with COVID-19. That's very much common because COVID-19 was spreading very much faster. But even after taking vaccine, if fever persists for more than 3 days, then 3 to 4 days, if fever is persisting, then you should definitely get tested for COVID-19 RT-PCR. That's very common because you should also get COVID-19 test done. Next is fatigue, malaise, weakness. That's very much common. Headache, vomiting, joint pain, dizziness, loss of appetite, abdominal pain, enlarged lymph nodes, excessive sweating, itchy skin, rashes. These could be a normal side effects, but these usually subsides on its own in a couple of days to a week. If it persists, then we need to give you a symptomatic treatment, like a tablet of paracetamol for the fever we can give. If the allergic response is there, then we can give any kind of antihistamines. After joint pain, then a tablet of paracetamol is sufficient, even for pain relief also. So the most common question which people ask is regarding the risk of clotting. Clotting risk is definitely important, but we need to understand that clotting risk is much more if people are taking cigarettes. if people are taking OCPs, if we compare it with the vaccines, yes, we have received the risk is way less. In a million patients, 39 uh, with 5 per million with after AstraZeneca vaccine. With Pfizer, there is 4.1, and risk without infection or vaccine there is 0.41. So the risk is definitely there, and but we can reduce this risk with regular checkups. If we are experiencing any kind of problems, if you are experiencing breathlessness, if there is sudden development of limbs pain, then we can just get it checked from doctor, and they will prescribe you some tests like Doppler is there for deep venous thrombosis, D-dimer we can get it done to check whether there is a risk of thrombosis or not. But these thrombosis risk is definitely there with Covishield. But with Covaxin, we haven't yet received any single case of thrombosis. Now coming to the main part, the myths and the facts associated with COVID-19 vaccines. So many people believe that COVID-19 vaccines are not safe because they were developed so quickly. But the answer is that COVID-19 millions have been vaccinated till now, and they have also been monitored for side effects. Until now, we haven't received any major adverse events followed by these vaccination. We have reported just one death, which came into news recently after taking the vaccines. But we have given so many vaccines, and we do expect that there could be some anaphylaxis. But if we are much more careful, then we can prevent those things also. Next is you can get COVID-19 from the vaccines. That's definitely not possible because you're using the inactivated viruses, or we're using the vectors which may not cause the disease itself, because the virus is non-replicating. It means that it may not multiply when it goes inside inactivated viruses. Third one is I have already had COVID-19, so I don't need to be vaccinated. Many people do ask that after getting COVID-19, I have developed antibody, so why do I need another vaccine shot? The answer is that the antibody which is formed after getting infected may not last longer than few months. These vaccines may boost your immunity further so that you can be prevented for much more longer time from the COVID-19. Myth 4 is the fatality rate of COVID-19 is so low, so I do not need to be vaccinated. But the fact is that vaccination is important because it not only prevents people from COVID-19, but it also protect you from hospitalization and death. Myth 5 is there is no need for mask wearing and social distancing after receiving COVID-19 vaccination. Fact is that these COVID-19 only prevents from the disease to happen. It may not protect, or it may not prevent from disease from transmission. Like it only prevents the infection to happen, but how much it prevents the transmission is yet to be known. Obviously, it must be stopping the transmission, but not that much. We may also expect the transmission to happen. So you should always wear masks and maintain distance. That's very much needed, even after getting vaccines, even after developing the antibody. The vaccines will alter my DNA. That was very much in the news recently because the RNA vaccines which we're using, and the RNA vaccines is something which may not go and mix with your DNA. RNA is something different. It will only create antibodies in your body, but may not go inside your DNA and alter your DNA. And mRNA by itself will naturally decline within 48 to 72 hours after creating an immune response, which will form the antibodies. 7. Individuals having COVID positives will go for COVID-19 vaccine after 6 months. Many people feel that the antibody which is formed inside your body will protect you for the next 6 months. So why do you take it for 6 months? You should take after 6 months. But the answer is not that. The government has decided that you need to only wait for 3 months after recovery, and after that you can take the vaccine because of um, the antibody which is there in your body may decline over time. So you may be prone to getting infected in the third wave also. You should get vaccines within the stipulated time. COVID vaccine is not to be given in pregnancy and lactation. Yes, the basic research which goes inside any development of vaccine, in that you need to present a safety data, quality and safety data in pregnancy, which was not available initially. That's why in pregnancy and lactation, vaccine was not recommended. But now we have got enough data for lactation, so we have recommended vaccination in lactation. But for pregnancy, there are many organizations which is recommending vaccination, but yet government will take the final decision whether to vaccinate in pregnancy or not. But definitely the pregnant women are much more at risk for COVID-19, so they should be given a COVID-19 vaccines. People with underlying conditions should not be vaccinated. As I told you earlier, that people with COPD, lung diseases, heart diseases, kidney diseases, even with cancers, HIV, should take vaccine. Although those with taking immunosuppressives may not elicit very good immune response after taking COVID vaccine, but still they should take the vaccines because that may give you additional protection. COVID-19 vaccines are not effective against the new variants. The recent reports which have come out has shown that the Delta variant, which is present in the India, the vaccines which we are using, the Covishield and Covaxin, are very much effective against the Delta variant. It helped to protect hospitalization and death also. And severe side effects of the COVID-19 vaccines are common. Yes, side effects are very common, but not the severe side effects. Common side effects like pain in the limbs, could be fever, headache, malaise, could be there with the COVID-19 vaccine, but serious side effects are not very common. I should opt for Covaxin. Yes, you can opt for Covaxin or Covishield. Whatever is available, you can go for that. There is no harm in taking either Covaxin or Covishield. Then the next is the mix and match. After taking Covaxin, whether we can take Covishield or not, or vice versa. Yes, there are many countries where they have tried mix and match with different vaccines. Like first they have taken Covishield and the second vaccine they can take Covaxin. There are the studies going on, and the preliminary data shows that the immune response after taking two different vaccines is definitely much more better, but they also have much more side effects. So still in India, we are not mixing the vaccines, but maybe in coming days, in coming weeks, there may be some guidelines on mix and matching of the vaccines. So if you test negative after more than 2 weeks of 2 doses of COVID-19 vaccine, it means you are not protected? Answer is no. Even after taking 2 doses of vaccines, if the antibody response is not yet there, it doesn't mean that you are not protected. It means you are being protected because, as I told you, memory B cells and the T cells also protect you from future COVID-19 infections. But we don't measure those memory B cells or T cells. That's why it may not show in the COVID IgG, which is commonly being measured. We are not measuring memory B cells and T cells, which also help you to protect against these viruses. That's why in some cases we may see that COVID-19 antibody is still negative, but if you're taken both the vaccines, then you shouldn't worry, you will still be protected. Yes, COVID-19 vaccine is for all, and for the pediatric population, which is recently being tested in USA. Pfizer is being given to 12 to 15-year-old kids. Even in India, the trials have started. In Patna also, trials have been started in names to protect children. And hopefully in the coming few weeks, there will be open vaccination for pediatric age group also. Thank you.
सर आप लोग क्वेश्चन पूछ सकते हैं.
Not only the
Hello.
question. If, हाँ.
Yes sir.
Yes sir.
हेलो सर, मैं मुर्तजाली बोल रहा हूँ. सर मैं समस्तीपुर से बोल रहा हूँ.
हाँ बताइए.
हेलो.
हाँ
सर
बोलिए.
मैं मुर्तजाली समस्तीपुर से बोल रहा हूँ.
हाँ बताइए बताइए.
सर मैं पिछले ईयर में आपसे इलाज करा रहा था. आपने बताया था कि लीवर में जो है इधर सर 1 महीना पहले भी जो है सो मेरा वही केस आ गया और लीवर में सूजन हो गया. मैंने अल्ट्रासाउंड करवाया तो फेज 2 बताया वो सूजन का. तो मुझे मेडिसिन तो दिया जा रहा है, तो मुझे ये मतलब जानकारी चाहिए था कि इस स्थिति में क्या मैं वैक्सीन ले सकता हूँ?
बिल्कुल बिल्कुल. आपको अगर फैटी लीवर भी जो होता है ना, फैटी लीवर ग्रेड 2, अगर फैटी लीवर है तो उसमें भी आप वैक्सीन ले सकते हो. फैटी लीवर ग्रेड 2 में बस आप खाने में तेल ये सब कम खाओ, रेगुलर एक्सरसाइज करो, आपका वो फैटी लीवर कम हो जाएगा. वैक्सीन आप ले सकते हो.
तो सर वो वैक्सीन लेने के साथ साथ जो दवाइयां हमें प्रिस्क्राइब की गई हैं वो दवाइयां भी डेली लेता रहूंगा?
बिल्कुल बिल्कुल. आप दवाइयां भी आपको लेते रहना है और साथ में आपको वैक्सीन भी लेना है.
और वो पैनक्रियाज जो इंक्रीज हो गया तो उसमें तो कोई प्रॉब्लम नहीं होगा?
नहीं, अगर पैंक्रियाटाइटिस के भी पेशेंट्स, अगर आपको अभी कोई बीमार नहीं हो, अगर हॉस्पिटलाइजेशन की जरूरत नहीं है, तो आप वैक्सीन आराम से आप ले सकते हो.
अच्छा सर, इसका कोई साइड इफेक्ट इसके जरिए तो नहीं होगा ना?
नहीं, इससे जरिए नहीं.
थैंक यू.
Not only the questions, if any wants to share any experience.
वहाँ पे गए क्या हो गया मल्टीपल से क्या प्रॉब्लम है?
अगर कोई अपना एक्सपीरियंस भी शेयर करेंगे तो then the discussion will be very fruitful.
सर कोई क्वेश्चन लगता नहीं.
So if we don't have any question, then we would like to conclude here. Before that, I would like to thank very much Dr. Pratyush Kumar, our speaker, eminent speaker, who has given his valuable time to brief the things very nicely. Sir, thank you very much to be a part of this discussion. And I also I would like to thank you, all the participants, on behalf of Alembic, that you have given your valuable time. Because this is a very, very important topics nowadays, and we all are confused as because we are not exposed to such kind of situations in our life before. So with this, I would like to conclude here. On behalf of Alembic, I assure you that such kind of academic discussion we will be trying to continue to clear all the doubts in the minds of the medical fraternity, so that they can treat the patients, they can advise the patients in this pandemic situations, and enlighten the common people with the help of science and knowledge. So with this, thank you very much. Be protected, advise all the people to be vaccinated to become a healthier nation for tomorrow. Thank you very much.
Thank you, sir and team.
Thank you. Thank you.